Hi guys, today we're going to talk about a really important topic called birth control and a condom campaign. But why is this important? Because in our age, you don't want to have babies because you don't have the money and neither the maturity. Birth controls help you to have safe sex without having babies. But let's talk about some examples of these birth controls. First, we have the combination pill. But what it does? This birth control mainstay is still 99% of effective against pregnancy when taken around the same time every day. It's also known for easing hot flashes and restoring regular periods. Smokers and those of 35 or older, the estrogen may cause dangerous blood clots. If you suffer from migraines, you should also pass because it may trigger pain. Now we have the progestin-only pill. Known as the mini pill, progestin-only, meds don't contain estrogen. They're safer for smokers, diabetics, and heart disease patients, as well as those at risk for blood clots. They also won't reduce the milk supply for women who are breastfeeding. Who should avoid it? If you have trouble, remember to take your pill at the same time every day. Progestin-only pills might be not your best bet. They need to be taken at exactly the same time every day. If you are more than 3 hours late, plan a using backup method. Extended cycle pill. What it does? These pills prevent pregnancy and allow you to have a period only every 3 months. Why you should avoid it? There is no evidence provided it is dangerous not to have periods, but there is still no long-term research to show that it's safe. We have the diaphragm. It's very usually, actually. What it does? Made of rubber and shaped like a dome, a diaphragm prevents sperm from fertilization and egg. It covers the cervix and must always be used with spermicide. Women must be fitted for a diaphragm in their doctor's office. We have IUD, but what it does? Paragraph is a surgically implanted copper device that prevents sperm from reaching the egg. Mirena, also surgical implanted, works by releasing hormones. Intrauterine device, IUDs, are more than 99 effective and good for 10 years. Then we have the patch. But what it does? You can place the hormone releasing patch on your arm, buttock or abdomen and rest easy for 1 week. Who should avoid it? If you are particularly at risk for blood clots, you might want to find a different method. The patch delivers 60% more estrogen than a low-dose pills, so you are not increased risk for dangerous blood clots. Then we have the implant. They also call implant or Norplant. What it does? About the side of the matchstick, the implant is placed under the skin on your upper arm. Implants last for 3 years and can cost up $80,000. They are nearly 1,000% effective. You should avoid it. Implanton may not work as well for women taking St. John's wort or women who are overweight. Then we have the sterilization. Women can undergo cesar-tubal ligation, a surgical procedure that blocks the fallopian tubes for carrying eggs to the uterus, or tubal implants, a neurosurgical technique in which small coil is inserted into the fallopian tubes. The sterilization process is less risky for men. A vasectomy. This is a minor surgery in which the tubes that carry sperm from the testicles are cut. If you plan to have children, sterilization is not an option. Now we're going to talk about the most effective birth control system, the condoms. The condom is a shielded-shaped barrier device that may be used during sexual intercourse to reduce the probability of pregnancy and decrease the risk of sexually transmitted infections, so STI, such as HIV, AIDS. It is rolled onto an erect penis before intercourse and blocks ejaculated semen from entering the body of a sexual partner. Condoms are also used during fellatio and for collection of semen for use and infertility treatment. In the modern age, condoms are most often made from latex, but some are made from other materials such as polyurethane, polysopren, or lamb intestine. A female condom is also available, often made of nitrile rubber. As a method of birth control, male condoms have the advantages of being inexpensive, easy to use, having few side effects, and offering protection against sexually transmitted infections. With proper use and use of every act of intercourse, women whose partners use male condoms experience a 2% per year pregnancy rate. We typically use the rate of pregnancy is 80% per year. Condoms have been used for at least 4,000 years. Since the 19th century, they have been one of the most popular methods of contraception in the world. While widely accepted in modern times, condoms have generated some controversy, primarily over what role they should play in sex education classes. Condoms are widely recommended for the prevention of sexually transmitted infections, STI. They have been shown to be effective in reducing infection rates in both men and women. While not perfect, the condom is effective reducing the transmission of organisms that cause AIDS, genital herpes, cervical cancer, genital warts, syphilis, chlamydia, gonorrhea, and other diseases. Condoms are often recommended as an adjunct to more effective birth control methods, such as IUD, in situations where STD protection is also desired. Well, as you can see, condom is the most effective birth control system, and also it prevents sexual disease. This is very important to have a healthy life to avoid those diseases. So, if you are going to have sex, please use one of these birth controls, and especially use condom. And remember, without balloons, there is no party.